Chloroquine phosphate, also known as chloroquine, is a medication used to prevent or treat malaria caused by mosquito bites. It belongs to a class of drugs known as antimalarials. The United States Centers for Disease Control provide updated guidelines and travel recommendations for the prevention and treatment of malaria in different parts of the world, so it's important to discuss the most recent information with your doctor before traveling to areas where malaria occurs. In addition to malaria, chloroquine is also used to treat infection caused by a different type of parasite called ameba. It's important to note that chloroquine is not recommended for the treatment of coronavirus infection, also known as COVID-19, unless you are enrolled in a study. It's crucial to talk to your doctor about the risks and benefits before using chloroquine for any medical condition. The recommended daily dosage and optimal timing for taking chloroquine should be determined by your doctor based on your specific medical condition. Be sure to follow your doctor's instructions carefully and ask any questions you may have about the medication. When taking chloroquine phosphate, it's important to follow your doctor's instructions. Take it by mouth with food to prevent stomach upset, and the dosage and length of treatment will depend on your medical condition and response to treatment. For children, the dosage is based on weight. To prevent malaria, take chloroquine once a week on the same day each week, starting 1 to 2 weeks before entering a malarious area. Continue taking it weekly while in the area and for 4 to 8 weeks after leaving, or as directed by your doctor. If you are treating malaria or an amoeba infection, follow your doctor's instructions carefully. It's also important to take chloroquine at least 4 hours before or after certain other medications, such as kaolin for diarrhea or antacids, to ensure your body fully absorbs it. To get the most benefit from chloroquine, take it regularly and exactly as prescribed by your doctor. Don't stop taking it without discussing with your doctor, as stopping too soon could lead to infection or a return of the infection. If your condition persists or worsens, talk to your doctor. Remember that chloroquine may not prevent malaria in all cases, so seek medical help if you experience fever or other symptoms of illness, especially while in a malarious area and for 2 months after returning. And don't forget to avoid exposure to mosquitoes. Side effects may include nausea, vomiting, abdominal cramps, headache, and diarrhea. If any of these effects persist or worsen, notify your doctor or pharmacist. Remember, this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks. Many people using this medication do not experience serious side effects. Notify your doctor immediately if you experience any serious side effects, including changes in heartbeat, symptoms of heart failure, mental/mood changes, hearing changes, easy bruising/bleeding, signs of liver or kidney problems, muscle weakness, unwanted movements, hair loss, or changes in hair/skin color. This medication may also cause low blood sugar, so be sure to monitor your blood sugar regularly if you have diabetes. Notify your doctor if you experience symptoms of low blood sugar. Seek medical attention immediately if you experience severe dizziness, fainting, fast/irregular heartbeat, seizures, or any serious eye/vision problems. While a serious allergic reaction to this drug is rare, seek medical help if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Before taking chloroquine, make sure to tell your doctor or pharmacist about any allergies you may have. Also, be sure to inform them of your medical history, especially if you have certain enzyme problems, vision/eye problems, hearing problems, kidney disease, liver disease, or skin problems. If you have diabetes, this medication may affect your blood sugar, so be sure to monitor it regularly and inform your doctor of any changes. It's important to limit your time in the sun and use sunscreen, as this medication may make you more sensitive to sunlight. Additionally, be sure to inform your doctor about all the products you use before having surgery. Chloroquine may also affect the heart rhythm, so it's important to discuss any heart problems or medical conditions you may have with your doctor. If you are pregnant or breastfeeding, be sure to discuss the risks and benefits of taking chloroquine with your doctor. It's important to be aware of potential drug interactions with chloroquine phosphate, as they can change how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with chloroquine phosphate are mefloquine, penicillamine, and remdesivir. Additionally, many other drugs besides chloroquine may affect the heart rhythm, so it's important to be cautious. Certain vaccines, such as the rabies and cholera vaccine, may not work as effectively if given while you are taking chloroquine. Be sure to ask your doctor for more details on this. Remember, always consult with a healthcare professional for the best time to take this medication and the appropriate daily dosage. If someone has taken too much chloroquine phosphate and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical help by calling 911 or contacting a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include fast or irregular heartbeat, fainting, slow or shallow breathing, unwanted or uncontrolled movements such as twitching of the tongue or face, and seizures. Remember, it's crucial to take medications as prescribed and never exceed the recommended dosage. Always consult with a healthcare professional for the best timing and dosage of chloroquine phosphate. When taking chloroquine phosphate, it's important not to share it with others. If you are taking this medication for a long period of time, you may need to undergo lab and/or medical tests, such as eye exams, reflex tests, liver/kidney function, EKG, and complete blood counts. It's crucial to keep all medical and lab appointments and consult your doctor for more details. If you are traveling to an area at risk for malaria, it's important to take precautions such as using protective clothing, insect repellent, and bed nets. Try to remain indoors or in well-screened areas when possible. If you are using this medication to prevent or treat malaria, it should only be used for your current travel or condition. Do not use it later to prevent or treat another infection unless instructed by your doctor. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Don't take double the dose to make up for the missed one. Make sure to store chloroquine phosphate at room temperature and away from light and moisture. It's important to keep it out of reach of children and pets. When it comes to getting rid of any leftover medication, don't just flush it down the toilet or pour it down the drain unless you're told to do so. Instead, make sure to properly dispose of it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.